Hello, I'm Brittany Kesselman. I'm a research associate at SWOP, the Society Work and Politics Institute at Wits University, and I'm also a co-founder of the food justice collective We Will All Eat. This is one of a series of conversations on COVID-19, the right to food, and radical politics. Today, I'm very pleased to be speaking to Dipa Sinha. Dipa Sinha teaches economics at Ambedkar University in Delhi. She has been associated with the Right to Food campaign India over the last 15 years and has also worked with the Office of Commissioners to the Supreme Court of India on the right to food. Welcome, Dipa. Thanks for joining us today.
Thank you. Thanks, Brittany.
To begin with, could you just tell us a little bit about the Right to Food campaign in India, as well as your own history and role in it?
So the Right to Food campaign is an informal network of individuals and organizations across the country who came together basically to fight for the right to food for all, with the belief that given the constitution that we have in India, that the state bears the primary responsibility to ensure that no one sleeps hungry and that everybody is well nourished. One of the first actions or the campaign kind of came together around a public interest litigation in the Supreme Court, which was filed in 2001. The primary claim of that PIL in the Supreme Court was saying that we have a right to life with dignity in our constitution. So we went to the court with the question of whether that means that there is right to food also. And if it means that people have a right to food, then how does that get operationalized? That was like broadly what the case was about. And the context of the case was that we had these overflowing public granaries at that time. And at the same time, there was drought in the country and many reported starvation and hunger related deaths. So since then, the campaign took off in various ways and has been fighting for, lobbying for different legislations, policies, programs, and so on. One of the, for instance, in 2005, we were centrally part of a campaign for a National Rural Employment Guarantee Act. In 2013, there was a legislation called the National Food Security Act that was passed. So a number of these legislations, the Supreme Court litigation, media, working with media, mobilizing people on the ground. These are the kind of things that the campaign does, but it is a voluntary network. So all of us have our own day jobs, or there are different maybe NGOs, trade unions, women's organizations who come together on the issue of right to food. Yeah, you asked my involvement. I used to, so under the same case in the Supreme Court, the court appointed an office. It's like was like an ombudsman's office to monitor, because it was a continuing mandamus which went over almost 16 years. So this office was appointed to monitor whether those orders that the court was passing were actually getting implemented on the ground. And I was working in that office where we used to also do research on hunger, on malnutrition, and we used to try and work out these tripartite kind of arrangements where the government could talk to the civil society and both together could report to the court on what was happening, because the litigation was not seen as something adversarial, but as how can we all work together with the institutions we have to ensure right to food. So that's how that was my formal engagement with the Office of Commissioners, but I have volunteered, been an activist with the campaign throughout, and even after I stopped working for the Commissioner's Office.
It's a really impressive campaign. You described a bit about the context at the time the litigation started. What was the context like in terms of food sort of a few months ago, just prior to the COVID-19 situation, and what does it look like now?
At one level, over almost 20 years now, what we do see that, say, measurable forms of hunger, if we say in the form of malnutrition, there is some improvement in India where about 50% of children were malnourished. Now we have 38% children who are malnourished, which is still very high. 38% stunting for a country like India, which is not so poor anymore in terms of its per capita income levels, we still have high malnutrition levels. Also, the last 3 years in India, 3-4 years, there has been a kind of an economic slowdown. So while the economy was growing, we were having a lower growth rate, increasing inequality, There's been a stagnation in rural wage rates for almost 6 years now. So we were in a situation where, so it is not a food crisis in the sense that there is no availability of food, but because there is definitely a crisis in employment and livelihoods, there were reports of increasing hunger from different parts of the country. And ironically, again, we are faced with a situation now where the government godowns, where the government stores what each procures, the rice and wheat, is overflowing. They don't have place to keep the grain. And we had these reports of hunger. And in that context, in the third week of March, we had this very unprepared for lockdown, national lockdown that was announced. So it was announced on TV at 8 p.m. in the night by the Prime Minister, giving us 4 hours time to do whatever you had to do to get yourself ready. And that, of course, again has very unequally affected people. So so food is so much linked to livelihood, and over 90% of our labor force is in the informal sector. So what we have been seeing over the last 3 months is a completely different crisis, where actually you forget about the virus and the disease, and you're thinking about the human created crisis as a response to the disease. So we've had millions of migrant workers who've been stranded in different parts of the country, who have not been earning wages and therefore unable to live and unable to feed themselves where they are, struggling to go back to their homes, which sometimes involves walking more than 200-300 kilometers or even more. So I don't know if you've seen it, but if you just Google it or look at any of the media, you can see these really heart-wrenching pictures of families with young children, old people, who've not eaten for 2 days, 3 days, who are just walking in the hope that they'll get to their village and then they'll get some food and get maybe some livelihood. So it's been a very difficult situation, and there are some relief measures that the government has announced, but that is way, way too little compared to the kind of problem we are currently facing.
And when migrant workers find their way to their villages, is the food situation better in the rural areas right now?
Relatively, one can say, but so just to give you another context, the lockdown was imposed just when harvest was going on of the winter crop. So wheat was being harvested, and what happened was that in most places the farmers managed to harvest the crop, but then because the lockdown was imposed, they were not really able to get the crop to the market. And so we do have some data which says that the amount of, although they then said that even in lockdown that the agricultural markets can function, but the transport systems were all disrupted. So we have some data coming in about, if you compare with last year, how much is coming into the markets in terms of fruits, vegetables, or grains has come down quite significantly. But on the other hand, the production did happen. It was a good harvest this time, especially the wheat harvest. And so I think when people go back, it's still better than the situation in urban areas, because here they need cash to access any food. And the hope is that when they go back, they'll get some food at least, but doesn't know how long, it won't last for very long. And also that eventually the livelihood issue will have to be resolved. And we must also remember that all these people were in the urban areas in big cities in the first place because there was no work available um, in where they were. So now if all of them have gone back, it can become a huge crisis. But currently the urban looks even more worrisome.
You mentioned that there are some government relief efforts. Could you tell us what kinds of measures have been put in place?
So basically, broadly, the first round of relief that the government announced was twofold. One was food distribution and the other was cash. So in terms of food distribution, what they announced is that people who have a ration card, that is people who are covered under the public distribution system in India, through which they get subsidized grains, which is about 60% of the current population, they announced that they would get 5 kilos of grains additionally for free for a period of 3 months. And the other was, they said that all those who were beneficiaries of various social security pensions under schemes like the old age pension or widow pension, disability pension, and so on, they put in an additional amount of rupees 1,500 into those accounts, which is again a very small amount. It was rupees 1,500 for 3 months. A dollar is 70 rupees. So something like $20, $25 is what they put in. So these very small amounts of cash transfers is what they did. And even with the food, the issue was that they said that the food was for those who already were in the ration system, which again kept out all these migrants who are usually out of the system, because even if their name is in the ration list, it's usually in the list back home in the village, and they cannot access the rations where they are living. And in big cities like in Delhi, where I live, the government did set up a lot of like soup kitchens across the city in schools, which were of a huge, I mean, they were very helpful. According to the government's data, about 1 million people every day in Delhi still go to these kitchens for lunch and dinner. But still, we have reports of people walking back and being hungry.
Wow. And I would imagine amongst the different member organizations of the Right to Food campaign that there are probably other kinds of relief efforts as well.
Absolutely. So what we have been doing, and not just the Right to Food campaign, all kinds of organizations, part of the civil society in the country, whatever issue they've been working on. Currently, everyone is engaged in relief work, given the scale of the problem. So there are many of us, many networks are running helplines where we get calls from stranded workers or migrants. And what all of us have been trying to do is to mobilize food, mobilize funds to. So there are various models. Some of us are distributing cooked food. Some of us are distributing dry rations. Over the last 2 weeks now, they've allowed buses to ply and they've opened up some trains. So the effort has also been to arrange for buses for people who want to go back, arrange for train tickets for people who want to go back, and so on. So that's also an additional thing that we are doing.
And I'm wondering how you would characterize these different food relief efforts and other relief efforts. Are they generally framed as rights-based, as solidarity, as charity? Sort of what is the thinking behind them?
So you see a bit of everything currently because there's so much hunger all around. So for instance, say the Right to Food campaign itself, while we are on the one side doing this thing of trying to whatever we can respond to the SOS calls that we get. So say there are 200 people hungry somewhere. So it is where we are appealing to charity as well as an immediate response. Although we do believe that there is a right and it is the state should have got there. But then the immediate response sometimes does, that's where you can manage to raise funds from. There's a lot of religious charities distributing food across the country. There are a lot of these online crowdsourcing, fundraising happening for food. So there is that whole charity element to it. But on the other hand, campaigns like ours have also been continuously putting pressure on the state, saying that, I mean, these people are workers and that they have rights. We have a National Food Security Act, and that the state has to get its act together. So that we have been doing. Again, our usual forms of organizing in the forms of picketing or demonstrating is not possible in the current situation. You can only do these calls. But we have been writing open letters to the Prime Minister, to various ministers. We have been doing SMS campaigns. We have been doing using the social media as much as we can through Twitter and Facebook and so on, to also spread this message, because like I said, it's not the case that the government doesn't have the grain. I mean, we think there is a fundamental injustice there, that there is so much grain going waste. There is a good harvest, there's a crop. The farmers are not getting any money for what they've produced because the markets are not functioning. So we do think that both from the point of view of the rights of the farmers as well as the rights of the consumers, this is the time for the government to really step in and ensure that people get a full balanced meal, so that the producers get a price for it and people are also able to eat. So we have been continuously responding to what the government is doing and trying to put out things saying what they should be doing, aligning with other groups. A very little response yet.
It does sound like there, like so many other places in the world, the lockdown is what really exposes a lot of the flaws in the market-based food system. And I wonder if it's opening space for alternative food systems in any way, if you're seeing small scale farmers organizing alternative ways of getting their produce out to people, collectives, cooperatives, solidarity purchasing, are things like that coming up as well?
Not at a very big scale, given the size of the country. It's also still happening where there is some NGO which has been doing this kind of work and which is kind of catalyzing that from happening, but unfortunately not so much. But on the other hand, what you said in the introduction, that in South Africa, that the government's response is also through these large food and industrial food systems, that is something also we don't see. I mean, in terms of both the charity as well as the government response, it's still been largely, for instance, I was talking about Delhi. So we have kitchens in schools have been converted to kitchens basically, and feeding centers. So, and it is still in that sense local food, of course, at a very large scale, but it's not packaged processed food um, that's being distributed. That is not the problem here as of now.
And is there any discussion around the need for an alternative to the current system? Is that coming up right now? Here, for example, the idea of basic income was very unpopular before, but has become a lot more mainstream at the moment, and more localized food systems have also sort of risen on the agenda at the moment. Is there discussion around these kinds of alternatives?
Absolutely. There is a lot of discussion around, in fact, an overall around an alternative economic model, let's say, not just to do with food. Because like you also said, the lockdown is really, now they're really in your face. The lockdown has affected people very, very differently. For some of us, the conversations is about, oh, how do you work from home and how do you spend your time? Are you learning baking kind of thing? On the other hand, for some people, the issues are, where do we get our next meal from, and how do I take my 80-year-old mother 1,000 kilometers away to my village while we are walking? So that kind of amplification of the inequality, I think somewhere at least has touched the hearts of a lot of people who didn't know that this is what our country was about, or who did not think about it as much. On the other hand, also the whole thing of the environmental impact of the lockdown, which is also this ironical, that I mean, it is a fact that Delhi has cleaner air now to breathe, and you're able to see the sky and things like that. So which is also kind of motivating people to ask questions of what is this economic model that we have been all depending on, and why was it, first of all, this kind of a situation that there's so many people working in such precarious conditions, so far away from their homes, in such different places. What brings us to that? So there is some discussion on having more localized, discussion on small scale industry, rural industrialization. And now, if all these migrants have gone back, do we just wait for them to again come back? Or what kind of models can we think of that you can actually create more sustainable employment where they are? And all this, of course, links to the food system also quite centrally, on what kind of food system this kind of a model would generate.
Hmm.
Just to add another, that this kind of questions are also coming because what we have seen through the lockdown is not just that the government is not responding in terms of relief, but also we are seeing some very regressive measures being taken. So, for instance, many state governments have used this opportunity to dilute their labor laws, saying that because the economic activity is down, and to boost investment and to start things again, minimum wage laws can be ignored for X number of months, or the working day can be increased from 8 hours to 12 hours. You don't have to pay overtime. So there's also all of this going on in the side, where rights-based campaigns were actually demanding that people should continue to be paid even through the lockdown period, even if they are not working. What we see from the government is actually that even now when activities are resumed, that they would be on even worse uh, conditions. So therefore, this whole question of labor rights, who does, where does production happen? Who does it belong to? How is value generated? Those kind of questions are all being asked again. And on the relief measure side, like you said, basic income, which was not a very popular idea in India either, particularly because in India, it always, even amongst activist groups, because it was always posed as an alternative to food transfers or providing universal health. Right now, at least till the lockdown and the aftermath continues, most of us also see a point in having a combination of both. We do see that there is a need for an income transfer along with a food transfer, and of course health facilities, which is another disaster.
It's interesting that there's space for more progressive ideas and, of course, more regressive and repressive actions at the same time. And I noticed on the Right to Food campaign website that different states have sort of different measures. So I'd also be interested, sort of a two-part question. What do you think, what kinds of actions and measures are needed to push towards the progressive end of things, moving out of this crisis? And also in India, would those be sort of state level campaigns or would they be national level? What's the scale of action to move things?
So, like you said, a lot of the way the responsibilities are divided by the constitution in India, a lot of the social sector subjects, they're state subjects. I mean, the states have a final say in how they are done. And implementation, particularly, even if it's funded by the center, finally comes down to the state. So, for instance, say in the ration system, it's the center that procures grain and pays for it, but it leaves it to the states to decide who it will give to. Like, what the criterion will be and what the system will be, and so on. So we see our struggle being both at the state and the national level. The state level is also more responsive these days. It's kind of easier. At least some states respond, some don't. There are different parties in different states. So you have a greater space. They have a ear closer to the ground, and they do. But the big challenge is that while the constitution gives the responsibility of the social sector to the states have very few powers to generate resources on their own. So all direct taxation can happen only through the central government, and then the center distributes, shares part of that with the states. And that is a big challenge we are facing now, that even in states which are very progressive and very receptive, after a point they're not able to take it forward because they don't have the resources, even if they have the will, and they're not able to generate their own resources because they just don't have the powers under the constitution to tax. And how else do you generate resources in such times? So we are in a bit of a bind there, and therefore we have to continue putting pressure on the central government as well.
You also mentioned the cleaner air in Delhi, as in so many other places. Are people making links between this crisis and the climate crisis, and also between the food system and this crisis and the climate crisis?
There is some discussion around this because we have, like particularly in Delhi again, the climate crisis, it has been quite severe, where for the last few years, every year in the winters, we've been facing the smog and schools being closed down because we just can't breathe. So, so that is something you immediately feel because it has been affecting daily lives. At the same time, we've also been in across the country facing much more unseasonal rains, um, other than the floods and the droughts, also just unpredictable climate, which has been affecting agriculture, although it has not been across the country. So one year somewhere it's something happens, another year it's a different place. So one can see the link. So now there is this, for instance, this whole locust attack that's been happening the last few days in all over North India, that people are seeing the links, that somewhere all of this is linked, and we have probably gone the wrong way in terms of the economic model because of which this is happening. There are, for instance, also questions asked on this. So our earlier food policy of the 70s resulted in the system where there is this excessive focus on rice and wheat, with some parts of the country which are not traditionally rice growing areas shifting to rice because that's where they got a remunerative price, because the government was procuring only rice and wheat. And so diets have changed, because of which the water levels have gone down in many parts of the country. Nutritionally also, polished rice, white rice is not necessarily the best. Some of the older millets which people were eating were healthier, healthier for the soil, healthier for the body. So all of this is definitely coming back into discussion, especially here where, because it is true that even in most rural areas, other than maybe for a few staples, everyone is dependent on the market for food. And that's something that's really hitting at a time like this. So it's not as if there's no shortage of fruits or vegetables or even meat and eggs in rural areas, because even there it's completely market dependent. And so some of these issues, which say something like Right to Food campaign has been talking about earlier as well, has a more receptive audience now, because people can see, I mean, it's affecting a wider set of people, and they can relate to what one is talking.
And of course, issues around the food system and alternatives in the food system are linked to broader questions, like you said, the entire economic model, also issues around access to land, to water, to energy for production or for cooking. What are some of the most important other issues that you would see linking to the longer term right to food?
Other than what you just one line, that water, I didn't say anything, but a big issue also, and has coming up even in the context of the whole hand washing issue, where this both these things of maintaining the social distancing and hand washing, how they sound so simple and easy to do, but the chat are so differently challenging for different classes, and their access to water in urban slums, that's of course a big issue. But also going ahead, like I said, I think one is definitely the link to livelihoods and employment. Finally, that is very closely linked to what kind of food system we can have and what kind of a society we move forward towards also. And that again, because it's not a new problem, it's been something that's been building up, and this pandemic and the lockdown has just blown it in our faces. And that is something also that is not going to get resolved the day the lockdown ends. It is going to be a longer problem. Like you said, it's related to access to natural resources, who owns the land, who owns the rivers, and so on. So that is one big challenge, within which, while we have a lot of movements and therefore a lot of ideas on issues of, say, land, of agriculture, of farming, and so on, urban issues in a country like India are now also something where we do need fresher ideas and much more thinking about the kind of urbanization that happens. Because much of the society activism in the country has also been very rooted in rural areas, and that's where we learn our lessons from, and then we kind of um, blow them up to the national level. But understanding urbanization and what kind of urbanization we want, that's one whole area. The other, of course, which some people are talking about not enough, is the whole issue of gender as well. This, even in relation to the pandemic and the lockdown, but so because, definitely in relation to food systems. And so who controls food is not just within the community, but even within the household, and that those two are linked, and that a more equitable gender relations have better nutritional outcomes as well. And for India, this is a big challenge, and we are actually we are seeing reports, for instance, of increasing domestic violence during the lockdown across the world, not just in India, but it's happening here as well. Increasing burden of care work on women through this whole period. And now with all these migrants going back, with more sick people. So there is a whole gender dimension to this, which would be the other challenge, I would say. That.
Mm. No, the situation you're describing is quite similar here. I wonder, we've certainly seen women being affected and often excluded here from some of the relief efforts. I wonder if there are particular groups. We hear a little bit about religious minorities being excluded, perhaps slum dwellers. Are there certain groups that are especially badly affected by the situation and perhaps most excluded from the relief efforts at the moment?
So there are, and it's the same groups that unfortunately get excluded always. So for homeless people, for instance, is a group that street children is a difficult to reach group always, at this time, with the lockdown and how strict it was in the initial phase, they were suddenly off the streets, but nobody bothered to find out where they went or uh, how they vanished. Of course, some of them got to the government relief centers, but it would have required more kind of effort. Over a longer period of time, uh, people, Adivasis, the tribal population who live in forests, close to forests, and once again, therefore difficult to reach, and for long, a socially marginalized group in India, and who are also now so market dependent that their lives are quite intertwined with what's happening in the economy, and the relief would not reach them as much. Single women headed households and old people, the disabled. Nobody's talking also about how to reach disabled populations, because we have very few home services that are happening. We still need people to get to a center or get to a bank to get their money out without transport, because transport has been completely stopped. So the traditionally socially marginalized groups are the ones that we are seeing. There is no special additional efforts, despite knowing that these are the groups who would be most affected, in trying to reach them. No efforts by the government.
Sure. And so, what are the key demands from the Right to Food campaign right now and going forward?
So, in the immediate term, like immediately, today, actually last month, what they should have done, and we hope, and what we're demanding is, one is a universal public distribution system for at least 6 months. So where you don't ask for any identity cards or income certificates and so on, but make food available, dry rations, food grains available to anybody who comes and makes a claim. And we think that this is a fair demand to make, because, like I said, the government is sitting on so much grain, and there is a network of fair price shops already. So every village has a fair price shop, which is in some ways the most easily accessible place that people can go to, but not to distribute only rice and wheat there, but to give a mix of commodities. So to include lentils, cooking oil, millets, eggs, so on. So one, because we do think that the situation of hunger is quite, it is serious, and that has to be addressed immediately. If you, before you can talk about people again going to work or whatever it is. Along with that, we have been demanding for a income transfer of at least 7,000 rupees per household per month. That's about $100 per household month, that also for 6 months, because again, that we do think that with all the supply chains being disrupted and everything being disrupted, the economy will take at least 6 months to start getting back to a state which is not the ideal situation, but where at least we go back to where we were. So that people need support to revive. There is no demand in the economy right now. People don't have money to buy anything, and therefore the various measures that the government has announced, other than the little bit of relief that I told you about, is mainly to do with easier access to credit for small entrepreneurs. But what we are finding, and we are quite confident it will be, is that the small entrepreneurs do not want to take more credit in a situation where they're already indebted and where they do not see a market available. Who will they sell to if nobody has money? So even for that the basic income transfer has to happen. So if you just ask me to tell you in short, these would be our two main big demands: a universal public distribution system and a universal basic income transfer. But at the same time, we do think that there are multiple other things that the state needs to do. For instance, we have an Employment Guarantee Act in rural areas. We need to see how that can be expanded to the urban areas. And we also need to see how we can use the employment generated through these acts to create the kind of things we were talking about, to strengthen a local food system, to strengthen local forms of, say, small irrigation, of soil conservation, these kind of activities to be taken up through an employment guarantee program. We have so much labor that has gone back to the rural areas, and it can be really productively used, we feel, towards both of these, towards conservation activities as well as towards care activities. So child care, making masks, there are so many of these other things that need to be on the pandemic. So linking employment to all of this in a slightly longer term, if not next month, but we need to start planning for that also uh, in some time. Then, of course, there are lots of issues related to the system itself. For instance, the tests are not free still for everyone, everywhere. And there are a lot of reports coming up on the impact on the non-COVID patients because there's been a complete disruption in health services. Many hospitals have been put aside for COVID. So the tuberculosis patients, the mosquito season is coming up. So we'll have the malaria, dengue, and so on. The antenatal care, immunization, all of this is happening at a much slower pace than normal. So to a revival of the non-COVID health services while we are addressing COVID is also another demand. And the labor laws, that they can't be allowed to use this crisis um, as an excuse to dilute labor laws, and they're doing it. It's again, I'm being very angry and negative, but it's also what they're doing with health workers. Like the government is putting out in some parts of the country advertisements for nurses in which clearly they're not even paying minimum wages, like for contract nurses because they need more. So that all of this, whatever you do, the response also has to keep in mind the rights of the service providers. So health workers, sanitation workers, the frontline workers who are working overtime without protection, without even wages in many cases.
Sure.
So that's a lot of demands, but yeah.
Yeah, well, they make sense. And how receptive is government to these demands at the moment?
Unfortunately, not very receptive. And so the government, the present government in India has not been very receptive to any civil society suggestions, not just relation to COVID and the pandemic and the lockdown, but so the lockdown also came at a time when the whole country was protesting an amendment to our Citizenship Act. So there was a lot of tension. I mean, it was not a case where the civil society is working with the government. I mean, there was a lot of protests going on. That is was the environment in the country when COVID began. So there is no trust. There is a lot of suspicion. The ruling party, I mean, through social media and otherwise, has been making villains out of a lot of people in the civil society who work on things like access to land, access to forests, who have been called left-wing extremists, terrorists. Some of them have been arrested and put in jail. So in that kind of a context, and there is a whole troll army on the social media. So when you make these kind of suggestions, you often are also faced with questions. And it's not just civil society, surprisingly, even media who's reporting the ground truths are often also faced with questions of, so what have you done for them? What have you done to help the poor? If you were going, so media journalists are being asking, instead of shooting videos of these people walking home, couldn't you arrange a bus for them? This kind of thing where there is almost a blurring of lines of what is the responsibility of the state and what is the role of the civil society or the media, where people also seem to be quite convinced and get swayed by these kind of arguments. It's very difficult to make rights-based arguments in this climate. So there has not been much reception, and there is all kinds of these kind of counter arguments. Even when the opposition party, the main opposition party, raises questions, this is the kind of response that comes. Like, it's if you had done your job 50 years back, then there would not have been so many migrants. So how dare you ask us what we are doing for them? No, that is the kind of rhetoric that we are seeing. So it's difficult.
Very difficult.
Yeah.
Before we wind up, I would be remiss if I didn't ask about Kerala, because from here at least we hear about things happening in Kerala in general, and now during COVID-19 that seem to be a sort of a best practice model compared to many other places. And I wonder if you also see it that way, and if other states in India are trying to model things after Kerala or reject it, or how does that look?
Absolutely. I think Kerala definitely is a best practice model and something we need to study much more in the context of COVID as well. But to understand COVID, Kerala, we also have to understand that Kerala has always been a best practice model in India. So it has been always had the best human development indicators in India. So the infant mortality rate, the life expectancy in Kerala are equivalent to some of the upper middle income or high income countries, far, far away from rest of the country. They achieved universal literacy like 20 years back when rest of us could not even dream of it, and that has to do with the social and cultural kind of politics that Kerala has had over the last 100 years uh, at least. So given that background, and I think we cannot undermine that background, also 20 years back Kerala started this very effective process of decentralization where they shifted funds and functions to the local government and gave them, empowered them a lot. And it is all that they have been really able to use at the time of this crisis to respond quickly. And this has been currently the Kerala government is a communist party. It's the CPM, a coalition of left parties. But in Kerala, it has been, but the local governments are about 60-40 of the opposition and the Communist Party, and all of them have been responding like this. So Kerala has had this history of progressive politics, also a history of a very strong welfare state kind of a model where the actually primary health centers work, they put money into these places and they are functioning. And especially in the context of the pandemic, I think they did two kinds of things which have clearly been quite effective and something not just rest of India but the whole world can learn from. One was just their preparedness. I mean, when they heard something like this is going on in China, they started preparing in Kerala because it is a state which has a lot of out migration. So they knew it would come at some point. Nipah came to them 2 years back. So they knew that. So they're doing the whole contact tracing, testing, isolation quite well. Although they are the only state who keeps saying, we know we cannot be complacent because migrants will come back. Even my people who've gone out will come back, and so the cases will increase. The other side to it, I think, which is even more important, is that it's one of very few governments who responded as a caring state. I mean, right from the beginning, there has been a care that has been taken not to stigmatize the COVID positive people, not to stigmatize the migrants, not to stigmatize anybody, but to say that the state is, I mean, we are in a crisis. The state has to take care of its people, and people have to take care of each other. These are both of these messages that you could see, like the chief minister does this press briefing almost every day, and you can see these are the kind of things he is saying, and that's a language we are not hearing anywhere else. That then translates into policies where every life is cared for. So we hear stories about, for instance, Kerala has had I think about 6 or 7 deaths only, given its burden of the number of cases. And they talk with a lot of pride that even if it is a 92-year-old woman, we will try our best to save that person. We are not giving up on any single life. At the same time, for instance, they stopped calling their migrants migrants. They said guest workers. They said, we have our guest workers, we will take care of them. And Kerala has a very different state from North India in terms of language, food, and so on. So they actually are trying to understand this and address the issue, telling the migrant workers that we understand you want to go back home, but you cannot. We'll try and give you your kind of food. We'll try and provide entertainment in your language. Please stay. You know, there would still be some people who are not happy staying there and wanting to go back, which is understandable. But overall, this kind of a caring attitude where you involve the local women's groups, the local governments, to go door to door, explain to people. So everyone from the chief minister down to the frontline worker seems to understand that this is not something where it's a war against some enemy, and that anybody, that it's something we have to fight together, and it's about solidarity. And that is something that's definitely working, and something all of us that should learn. It was one of the first states, even before the lockdown, to announce an economic relief package, despite being not having much resources, much better cash transfers than um, what the central government announced. Food, I mean, if you see the pictures that people have been putting up of the food that they're distributing, again, it's not just that rice and wheat, but it is a variety of food that people actually eat. So it is a state that we can learn a lot from. For me, the big lesson is the caring part of it. That if, I mean, the feeling you're getting everywhere else is that nobody seems to care. And I think if you have that, then everything else probably will fall in place.
Yeah, it really is an impressive and inspiring example. Um, I will give you a chance to add any final comments that you want before we wrap up. And also just to ask if maybe after the interview, you could send us a recipe of a food that you like or a food that's traditional for you. We're just trying to collect some recipes from the different people we speak to as well. But aside from that, thank you so much for taking the time today. And is there anything else that you would like to add?
Not really, but sure, I will send a recipe. And that if there's something like this going on what's happening in South Africa or even in the region, we would really be interested to know. And all of us have been quite uh, caught up with our own lives in post the lockdown and just our localities and what's happening around us. But I think we would really like to know how the other developing countries are responding to this. We hear a lot about the US and the UK and Europe, but we hear even South Africa or any countries in Africa what's going on. So if there are resources and if there's anything online, if you could share, not just me, I would share with colleagues in the campaign. We would be very interested to understand and learn.
Definitely. Well, we are gathering interviews from people around the world, and then we do hope maybe to bring everyone together in dialogue on a webinar after all of the interviews to sort of see if we can learn more directly from each other. But in the meantime, I'll certainly share with you some of the things that are happening here. It would be our pleasure. And good luck. Good luck with the campaign and stay safe, and we'll be in
Thank,
touch.
thank you.